So let's discuss some of those factors that could increase a mother's risk of preterm labor. We have a graphic here. Smoking, that goes without saying.
Well, I think
shouldn't be smoking at all.
Right. I think that really, when we look at these risk factors, these are risk factors that we could modify and change pretty easy. And I think that these are so important to change when you're pregnant. We should not be smoking at all. But when you're pregnant, you definitely should not be smoking. Smoking increases the chances of underweight babies and also of preterm labors. Another thing that is either, the big spectrum in life is either not to be overweight or underweight, by that matter. And I think that if you are doing a great control of your diet prior to getting pregnant, and once you're pregnant, you're going to decrease the chances of being in that spectrum in life. And also getting good prenatal care. If you don't follow your doctor's advice, if you don't go to your doctor's office on a regular basis and your prenatal care is not adequate, you have a higher chance of preterm labor. Alcohol, drug use, of course, alcohol has shown to cause alcohol fetal syndrome, which is a reason for multiple fetal anomalies. So alcohol is definitely discouraged during pregnancy. And having health condition, well, any type of chronic medical problem could definitely increase the chance of having preterm labor. I think a lot of those chronic medical problems could be addressed prior to getting pregnant, so you could decrease the chances of getting pregnant. And other risk factors, yes, if you have a baby that has a birth defect in general, there's a higher chance of having preterm labor. As far as in vitro fertilization, of course, every time that we do something that maybe is not as natural and somehow interfere, there is an increased chance, but the majority of the in vitro pregnancies will develop into a full-term pregnancy without any problems. Multiple pregnancy, anything that is greater than one, increase the risk. Nowadays, especially with in vitro pregnancies, we try to decrease the number of zygotes that are implanted. Therefore, you don't want to have 3 or anything greater than that, because definitely increases the chances. If you had a prior history of premature labor, there's definitely increased risk of preterm labor, and those patients should get certain medications that are given to prevent the recurrence of this.